All right, aloha. This is Dr. Joe from Ohana Chiropractic, and we've got Heather Watson today too. We're going to show you how an ASA treatment looks like, so you have an idea of what's going to be happening during your treatments when you're getting an ASA balance treatment. Heather Watson is one of our techs, and she would typically be doing all of what I'll be doing today for you, but for demonstration purposes I'll be doing it, okay? All right, so when we get started with the ASA balance, if you've ever done any previous treatments, then the first thing that we'll do on a follow-up treatment is that we're going to check to make sure that you actually passed your previous treatment. So Heather's going to hold that. And what we're going to do is that we have Heather's previous treatment here. And we're going to recreate what we did last time for her. And we're going to recheck that. So there's a specific point here on her finger called the allergy point that we actually check to make sure that while what we treated her for her is being outputted on her body here through this little device, we're going to make sure that her body is happy with that still. So we're going to test the allergy point, and that's a happy sound. That means that everything's good. That means that she passed her last treatment, okay? So now we're going to move right along to the next treatment. And when we do the scan, put some water on the arm here, and then this cuff is what enables us to be able to test the different substances or the different parts of the body and find out what's going on with the body. So go ahead and relax your arm there. So first of all, we need to calibrate the wrist cuff. This is kind of like a lie detector test. Works on some of the same principles. But we need to make sure that we have all of the connections correct, because we have actually 8 separate connecting leads that will test her body and make sure that we get a good test on all these different substances and bodies and whatever else that we're testing. We have a good, clear information about what's going on. And so right now, it's going through some funguses. And this right here doesn't mean a whole lot. It's just kind of pretty artwork here. But this is just telling us that the machine's connected to Heather and that we're getting everything tested well. Okay? Okay, great. So the scan is all done now. The typical scan takes anywhere between 3 to 4 minutes. And once we've scanned through everything, we get a big list of everything that is going on for the patient. And we typically go through and grab all of the top stressors, which could include emotions, various foods, different pathogens, and those are the ones that we usually use to be able to create what we call a work set, and that is exactly what we'll be treating the patient for. So for example, today we'll be treating Heather for perfumes, smog, and smoking. I don't think you're a smoker, right? No. We have a few emotions here too that we're going to be treating her for, some funguses, several different minerals, some different pesticides, and some different vaccines. And there's also several different organ systems here that we'll be drawing some information from that to help balance out whether it be her digestive system or her immune system. So we're going to go ahead and verify that work set, and we do now what is called a potency scan. This is the balancing rescan. So with all that information that we just scanned her on and all the different imbalances that she has, we're actually going to scan her and let the computer tell us now, okay, we've got all this information that she has some imbalances with, and how do we create balance for her, okay? So that takes maybe 30 seconds or so, and we actually are creating homeopathic frequencies that we then use to treat the patient. Okay, so now we have that remedy in there that we're going to use to treat her for all these different aspects of her health. And we're going to test that same point we tested before, and we want to make sure that it actually is happy for her body, or good for her body, and her body likes it, so we're going to treat her now. Okay, so on to the treatment. Do you have your bracelet on you?
No.
No. We will typically have a bracelet for the patient. we have a bracelet here, and there's some specialized metal inside of the bracelet that we actually imprint the treatment on, and the patient wears that bracelet 24 hours a day, 7 days a week, and it actually helps them stay in a balanced state for the duration that they wear it. Okay, so we're going to put that right in there. Oh, we do need to erase that first. Okay, so we clear out the previous treatment, put it right in here in the machine, and it's going to imprint the treatment right there on the machine. Now when we do the treatment, the practitioner wears some crazy glasses, and if the patient wants to wear them, they can wear them too. But we now have the laser. This is where the lasers come from, and the lasers we use as kind of like fiber optics to be able to transmit the balancing remedy into the body. And we do that through different points on the ear that help balance out different aspects of the body, and then also some nerve bundles on the back. So we'll go ahead and start here. Okay. Okay, turn your head. A typical treatment will take anywhere between 2 to 3 minutes to do. Okay, cross your legs the other way. Turn your head. There are 13 separate visits that will typically take a patient through, which will cover almost over 100,000 different things, substances, health issues, parts of the body, by the time we're done with those 13 visits. Turn your head. Most patients will feel a pretty good change and a difference with their health within the first 4 treatments. There's a small group of people. Take a deep breath in, deep breath out, pant, and breathe normal. Okay, there's a small group of people that will actually see results within the first treatment. And then there's another small group of people that won't feel any results until they get about to the 8th treatment. But I would say 90% of people who go through the program, by the time they're done with the 12 visits, and then look at their 13th reevaluation visit, they pretty much feel great. They feel like they're doing wonderful. They feel like they've achieved the results that they've wanted to achieve. All right, these points that we're doing right now are called the gate points. And these are the finishing points that we'll work on with the patient to finish off the treatment. And then if we have some time left, we'll work on some specific points in the ear specific to what the patient is dealing with. For example, if we have digestive, we'll work on the digestive area. Or if we have allergy issues, we'll work on the digestive or the allergy point. There's certain emotional points too. If the patient's dealing with depression or anxiety, there are specific depression points and anxiety points that we can work on to help either calm down the patient or actually help them with energy and feel less depressed. Okay. And there you go. So that was a full ASA treatment. And then at the end we have our bracelet now. And so Heather will wear that bracelet for her treatment. And then we're all done. So if you have any questions, feel free to contact me at from my email. There's a little place that you can click on the website that will direct you to an email that can go straight to me. I can answer any of your questions. You can call our office, 801-798-2781, and you can talk to anyone on the front desk about any questions you might have. And hopefully this has been helpful for you, and we'll see you later. Mahalo and have a good day.